I love that track. Johnny's Got a Girlfriend's the name of that track, and it is our track specially made for this radio show, Health Solutions with Shawn and Janet Needham. You are listening in on our Thursday weekly podcast, which we added a few weeks ago since this COVID lockdown, and it doesn't look like our state is going to open up fully anytime soon. Fortunately, our county did open up, so I finally got the opportunity to go out to dinner with my wife in this wonderful state of Washington. But I am headed to Idaho again today because Idaho does seem to be a little bit more liberty-loving when it comes to the lockdown of the coronavirus. So I've been spending a lot of time in Idaho lately. And actually, Oregon has even opened up more than our state of Washington. So I'll be spending some more time in Oregon next week and expanding our territory and in our pharmacy at Moses Lake Professional Pharmacy into Oregon. So about that track, my good friend Lee Pence recorded that track, and go to leepence.net or Guitarscape. He is a professional musician and can do great recordings. He has a great recording studio. So I love every time I hear that song, I think of my good friend. Talked to him this morning. So anyway, so you were listening to Health Solutions with Shawn and Janet Needham, where we discuss everything healthcare. I am your host, Shawn Needham, along with my producer today, Lindsay. She is working through all the behind-the-scenes stuff, which a lot goes on to produce this podcast / radio show. So today we have James Dunavant from the Free Market Medical Association. James is actually in Oklahoma, and we've had him on our radio show before. He was like our fourth or fifth guest, I believe. I think fifth guest. Super exciting. Glad to have him back. I will go ahead and let him introduce himself, but I will tell you he's the director of the Free Market Medical Association. And James, tell us a little bit about what the Free Market Medical Association is.
Yeah, the Free Market Medical Association is an education and advocacy group that started about 2014 by Dr. Keith Smith, who is the co-founder of the Surgery Center of Oklahoma, and a businessman who is an independent third-party administrator by the name of Jay Kempton. And they started the Free Market Medical Association really as an outreach mission for what they were doing here in Oklahoma City to advance free market healthcare solutions.
And what like, is there national membership? Is there state chapters? How does that work?
Yeah, we currently have about 350 members all over the country, 24 local chapters. Some states have more. Texas has 3 or 4, and Oklahoma has a couple. So some states have more than one, but we do have chapters all over the country as this has grown to physician-owned surgery centers all over the country, direct primary care practices that are now in excess of 1,000 practices all over the country, self-insured employers that are direct contracting with those individuals and facilities.
Well, I will tell you, I had the opportunity to go to a chapter meeting in Oklahoma back in January, and it was so refreshing to be around like-minded people in the medical system. It seems like at our pharmacy at Moses Lake Professional Pharmacy, we haven't been billing insurance since 2002. So we've kind of been some renegades a little bit when we stopped billing insurance because we just didn't believe that the patients got the best service at the best price that way. And there's a lot of people that thought we were crazy. And it was so refreshing to go to the Free Market Medical Association, almost 20 years later, and see like-minded people around us. So thank you for that invite, James. And I got to meet so many people. And one of the things I did, I was surprised but not surprised, is how many people across the country are going into, how many physicians across this country are going into direct primary care, which I'll let you explain a little bit of that. But from small towns to big towns, it's working everywhere across the nation. So tell us a little bit about direct primary care.
Yeah, well, direct primary care is really a relatively new model of healthcare that allows an independent physician to create like a membership model for payment so they don't have to take insurance. We say this is new, but it's really more of a throwback to the old days in a lot of ways, where most all physicians were, well, definitely all physicians were cash pay, and they would be paid by their patients in possibly eggs or chickens or whatever
Right.
was agreed upon between the buyer and the seller, just like anything else in society. So until the insurance model took over, that was really how things were done. So, over the last several years, we've seen a lot of physicians think more about retiring. We hear about physician burnout because physicians are spending so much of their time on administrative tasks that they frankly have had enough of the current system. So more and more primary care physicians have decided to adopt this direct primary care or direct care concierge. It's really started out, they called it concierge medicine. But the goal is really to limit the number of patients that you see in a day as well, and allows the physician to spend more time with their patient. Because the insurance and Medicare model, the goal is to see as many patients as possible so you can bill them. Most primary care physicians would have 3,000 or 4,000, maybe 5,000 patients, whereas the direct primary care model allows a physician to be more entrepreneurial, spend more time with their patients, open access to them to do more telemedicine and Skype and texting, so they can bypass a lot of the regulations by not being part of the insurance model.
Yeah, it's wonderful. I know in our pharmacy we work with a lot of those direct primary care offices, and it's just amazing the care the patients get, the time, and then how affordable it is. It's really, really affordable, and people are really surprised to understand how affordable it really is. And I mean, fees are anywhere from $50 to $100 a month, depending on what you get and the age of a patient. But it's very, very affordable, and that usually includes unlimited visits. So we've had a couple different episodes on our podcast/radio show with direct primary care providers on there, and go back and look at some of those shows. You can find out more about it. And really the insurance model is really, we think about it being the norm, but if you go back just to our radio show a couple weeks ago, we had Corey Little on, and he talked about a doctor in Atlanta, not in Atlanta, but in Georgia, that changed his life. She was a 94-year-old physician, and 30 years ago when he was in middle school, she changed his life by talking to him about changing his diet. And one of the most interesting things I thought was that the payment was $5, a $5 bill. And he said that she had a drawer of $5 bills in her office because that's what people paid her. And it's amazing that now a typical office visit in the traditional insurance model is like $300. And inflation has not, that does not correlate with inflation. So it's amazing what insurance has done to make things so much more expensive. And this is all in my book. If you guys go to Amazon, and my book called Sickened, how the government ruined healthcare and how to fix it. It's a pretty recent phenomenon. It's happened over the last 70 years, really, where the government has ruined healthcare by the insurance model. And go in there and look at, there's a 6-step solution also. And of course, people are part of that. Individual patients are part of that. So James, let's get back to, in the free market during this COVID lockdown. Tell me how you think the free market physicians could have helped this pandemic better than the government could have.
Well, I think what I've seen from this pandemic is that not only healthcare, but so many sectors of our society are highly controlled and regulated by the government. So in a free market, when people are free to make their own decisions and they're not told exactly what to do by a central planner, then you have lots of information, and you can respond to that information very quickly. Unfortunately, when you have a central planning organization that tells everyone exactly what to do, you have a one-size-fits-all model that you have no idea if it's really effective or not. until much later sometimes. As we saw with this COVID-19 situation, we had one or two organizations that were putting out statistical models saying that 2.5 million people would die in the United States. Well, we automatically trusted that as gospel, and we saw that care in the United States is so centralized. Despite all the great work that we've done with the Free Market Medical Association, most hospitals, the big hospitals, had to respond to that because they are receiving government money. So their licenses can be taken away, obviously, if they don't follow the rules. So I think in a free market, just like you see with businesses opening up in different states, we've seen that we've had some businesses defect from what the state governor has told them to do. So in a free market, I think some hospitals would have, every hospital would have, or doctor's office would have come up possibly with some nuanced solution that, they would rely on experts as much as possible, but they would also mitigate that in their own way. And we would have received feedback from the marketplace very quickly on what was working and what wasn't working. And then, different hospitals could make changes. I think we saw from this also that it was just very difficult for us to get information about how the disease was being spread. We were getting a different report on a daily basis. So there's so much conflicting information coming down that we really, it was hard to know what to believe at some point. And so I think the free market would have allowed more diversity of response. And then we would very quickly see what response made the most sense, and more people would follow that.
Well, yeah, I think one thing that we can take away from this too is that, when you look at this and it looks like things are winding down depending on who you believe, but it sure does look that way. Really, there was really only 3 or 4 places across the nation where there was, kind of an epidemic locally. There was some in Washington State, there was some in New York, for instance. And, speaking of the free market, and individuals making those decisions, if it wasn't coming from the top down, whether it be a central planner like the federal government or the state government, maybe those hospitals could have just locked down, or those local cities, instead of destroying a whole state. Is that kind of what you're thinking, James?
Yeah, exactly. We would have seen, I think we didn't find out until just the last month or so, maybe even the last couple of weeks, the extent to which nursing homes were affected by this. And so why is that? Why did we not hear about that information? I would say that in large part, it's because most nursing homes are not operating in the free market, and they were receiving their marching orders from some sort of central planner, or the state governors were ordering. A lot of the governors were ordering COVID-19 patients to go to those centers. So I think in a free market, a business person does not want their customers or their patients to die. I mean, that information would be disseminated very quickly to the public in such a way that people would then respond, well, I don't want to go to that restaurant necessarily, and there would be a natural mitigation process in the free market.
Yeah, absolutely. And I think that's one thing that we always talk about, why we need government intervention, and especially in healthcare, because people say, well, if there's a bad hospital out there, or, we want to make sure the government protects us from bad hospitals or bad nursing homes or bad doctors. But the reality of it is, in a free market, if there's a bad doctor out there, I know this sounds horrible, but they're not going to kill very many patients. And I don't think most doctors want to do that. Don't Don't get me wrong, but not very many patients are going to die, and it's going to get around that doctor's a bad doctor. So we think that the government protects us with these licenses, but in reality, you can make an argument that sometimes, those bad doctors get licenses and they're allowed to harm more patients. And there's some government organizations like that.
Yeah, what ends up happening is the government becomes more of a protector of the establishment of the big, corporate model. And, just as we see that a few large corporations own most of the media, the television stations and newspapers in this country, we now see that, or now it's more obvious that a handful of large corporations control the meat packing plants around the country. So we're seeing the supply chain problems across the board, not just in healthcare. We're seeing that this COVID-19 pandemic has unmasked the fact that all of our economy, most of our economy, is so regulated that those regulations create these cartels that we talk about in healthcare, the monopoly or quasi monopolies that go on, because the more regulations that you make, the more opportunity for consolidation, and the big guys always are going to be able to the regulations more than the small business owner or the independent physician.
Right. A perfect example is big pharma. The FDA has just created monopolies in with drug companies, because small companies can't compete because they don't have $1 billion to put a drug to market. Whereas, a big company does have that kind of money, so they can pay off the FDA to get a drug to market. And, in my opinion, what really happens is the FDA puts their stamp on a drug that may not be the best drug, but the drug company was just able to pay for those trials. And then in reality, if it was a small company in a free market, a few people at a time would take that drug and maybe get side effects from it. Whereas when the FDA puts their stamp on it, millions of people get the drug before we know there's a problem.
Yeah. Well, that seems to be the modus operandi, I guess you would say, is that all great innovations come from entrepreneurs and from the ground up in a decentralized way, but that at some point in the process, and the government is always involved in making this happen, the only way for anyone to then become the solution would be for the government to back that. So the CDC, the FDA, some organization that has the control and power of the state is going to have to say, this is the only solution for COVID-19 that you're allowed to have, and not have just a marketplace of ideas, a marketplace of solutions. Me personally, I might think that I want to focus on my immune health and check my vitamin D levels and make sure that I'm, getting the proper nutrition. Whereas, that doesn't make a lot of money for big pharma.
No. Yeah, you're absolutely right. And when in reality, we realize when we look at the data and the numbers now, the most important part, and it should have been obvious from the get-go, but the most important part of for preventing any kind of transmission or any kind of infection from a virus is to have a healthy immune system in the first place. So, and that's why it was so rampant in nursing homes, because they're elderly and they're immunocompromised a lot of times, and they have multiple comorbidities. So that's why we see so many problems in the nursing home. So you mentioned about government payments to some of these big clinics and big hospitals. So I've noticed that some of the big clinics and some of the big hospitals, they seem to be on the side of keeping things locked down. We need to keep it locked down. We can't open up yet. Yet their clinics and hospitals are being decimated. They're ghost towns. So can you explain a little bit about the payment from government sources and why they might be doing this?
Well, most of the big hospital systems, it's hard to feel sorry for them in this situation. I definitely sympathize with the 1.4 million healthcare workers that apparently have been furloughed, and many of them will possibly be permanently laid off as a result of this. But most of the big hospital systems are sitting on millions and sometimes billions of dollars in cash because they pay no taxes to the federal government. They get all kinds of subsidies, and they are incentivized by the system to sit on these massive investments. There was one, Innova Health System has $3.1 billion in investments. And most of the big hospital systems out there, if you look according to Moody's Investor Services, most of these big hospitals have enough cash on hand to sustain themselves without a dime of revenue for more than a year. So just like a big business can sit and wait for their small entrepreneurial competitor to go out of business, there certainly it could be a case made that these guys are very much hoping, or at least see the handwriting on the wall, that there might be an opportunity to gobble up some of the small independent practices out there, just like they've done over the past several years.
Yeah, I was going to say that's really been what they've been doing for the last 5 years or so. Is there's not a lot of independent positions left because the hospitals or some big clinic group have really gobbled them all up. So there's not a lot of independent physicians around anymore. And I think in reality, what really happens too is I think it plays into the government hand because I know in this state there's one big hospital group that's buying all the hospitals and big clinics, and in reality, it makes it really easy for the government because instead of having to control 5,000 physicians, they just got to control 3 or 4 hospital systems. And it really is about that, because when you look at, in my opinion, because when you look at that, most of those big clinics and most of those big hospital systems, 70% of their payment is from some kind of government resource, either state or federal resource. So of course they've got to comply with these regulations or they go under.
Yeah. And I think the other thing for me that this has kind of revealed is that, they're saying, which is true, that they've lost, these big hospital systems are losing billions of dollars just in the, first quarter or in the spring because of COVID-19. And they are admitting that the reason why that happened is because the quote non-essential procedures were banned in most states. So if 80% of procedures at these hospitals were deemed quote non-essential services, then my response is, you've just admitted to me that at least 80% of your services could have been shoppable if they're not essential, right? Which is what we've been saying for the last several years with the FMMA, and we're constantly told, no, I'm sorry, 80. There's no way that 80% of our services could have a price in advance. But I would say we need to push extra hard on these guys now to say that that's not the case, and we need to have more transparency than ever now. And they're going to have to, I feel like the big hospitals need to adopt price transparency even more now than ever, because their demand has been stripped from them because of this COVID-19 crisis. Not only even as these non-essential procedures are now allowed, as they're coming back, I think maybe 12 or 13 states are still not allowing these, non-essential procedures. But as they're coming back, it's going to take a while for people to think, I'm going to go and risk, getting exposed to some virus in a big hospital just to get my hernia repaired.
Yeah, I know. I'm with you. I think it is time for transparency. I think there's so many consumers that, even people that work for hospitals, I think understand the scam and the ripoff with the pricing inside a traditional hospital. Um, and quite often, I've used Dr. Smith from the Oklahoma Surgery Center, from the Surgery Center of Oklahoma, so many comparisons, and a lot of times it's 10-1. I mean, you can go to the Surgery Center of Oklahoma for $4,000, or you can go to a local hospital in Georgia for $40,000. And those consumers just need to know those things, and they need to start calling hospitals out. So I think our listeners and viewers know a little bit about my son's story. About 2 weeks ago, he broke his leg, and the care was good. He got from the ambulance ride to recovery and to discharge. Everything went really, really smooth. Wasn't really surprised or happy. I wasn't surprised, but I wasn't happy about the bill. And of course, we're fighting it a little bit. But the bill was $41,000 almost. The same procedure at the Surgery Center of Oklahoma was $6,375. And there is no reason for it to be almost, what is that? Is that 8 times more, 9 times more? There's no reason for that. And so I'm working with the hospital now. I'm getting an itemized bill. Realize, listeners and viewers, that you're in charge of that. Make sure you get an itemized bill. Make sure you ask them to give you a cash discount before you pay the bill. There is no fire. Also, you do not have to pay something right away. Insurance companies don't. So realize that. And there are a lot of models out there. If you go to the Surgery Center of Oklahoma, they have all kinds of surgeries on there that, like James was talking about, it's shoppable. So ask your local hospital before you go to have a surgery. Even if you have insurance, don't just think that. One of the problems is that we wash our hands of it as consumers, and we think, oh, well, our insurance covers it. Well, the problem with that is then the hospitals can just keep charging what they want. And realize that your insurance company doesn't pay the full bill. So you as a patient should not pay the full bill. You should get some kind of discount. So we are taking callers. If you guys have any questions for James, he's a great resource, Free Market Medical Association, 509-537-0411. So James, what is the future of this pandemic, and what do you think will happen with free market medicine because of this pandemic?
Well, I guess as I alluded to, I think there's a lot of opportunity for physicians that have seen the amount of control that they've been under. I think a lot of physicians, I've actually know some that knew early on that most of these deaths were happening in nursing care facilities, and they really couldn't come out and say that because they were owned. They had an employer over them that was possibly threatening them, or at least subtly threatening them, saying, "Okay, you can't say anything about this." So I think there are more physicians that hopefully will decide to go independent and start their own surgery centers. Reality is there's going to be a lot of push for more government control. There's going to be massive calls for massive bailouts, and most of that money is going to go to the big hospital systems, just like it goes to the airline industry. Like you were saying, you get a few, when the government can control better a few major corporations, like in the whether it's the food supply industry or the airline industry. And then once it gets to that point, they can always make the case that those industries or those companies are too big to fail. One thing that I noticed in all of this is that, Donald Trump could have a little meeting and meet with the quote leaders of a particular industry. He can meet with the leaders of the major hospitals. If you can do that, if you can sit down in a room and meet with a few people and talk about these things, then there's way too much control in the hands of just a few people. So no doubt, they've already had a number of bailouts, but we can pretty much guarantee that all these big hospital systems are making notes of how much money they have, quote, lost during this COVID-19. So that's another reason why they don't necessarily care, or possibly that they don't care, is that they think that the big guys realize and think that they're going to get some kind of massive bailout out of this. And
Yeah.
that will not, just like in the other businesses, the small business owner is going to be pushed out, and the big corporate guys are going to reap most of the benefits, unfortunately.
Yeah, I agree with you. And I think you could just see this from the beginning, how the big clinics and big hospitals just seem to be, more on the side of locking down. And they realize that, you know, that, historically speaking, it's just hard to close a hospital down. The government won't let it happen, so they'll keep bailing them out. And this is nothing personal against the hospitals. I'm not saying they don't do a good job or not. I'm just saying that, if it was a true free market, I think we would see, more, just more individuality. And there would have been, some clinics might have decided to not do surgeries. Some might have decided to do surgeries. It would be all individuals. So,
Yeah,
I
and
think.
a legitimate business owner, I think, if you're sitting on $3 billion in investments for your company, you're probably, I think a lot more business owners are inclined to say, you know what, times are bad right now, but I'm going to keep my staff. I'm going to furlough my. A lot of are they're still suing the and so they don't reserves that they've built for years and years based on overcharging patients. They want to have that money because that is what gives them leverage to borrow more money and have a great credit rating for them to build and expand and do more things to make lots more money in the future.
Yeah, and realize some of the way they get this money too is through their rural health designation, and they get paid depending on the size of the hospital, millions and millions of dollars, for their rural health designation. And really, what it allows them to do is it allows them to keep their monopoly in their local community. And independent physicians can't really compete because a lot of times they can't get that same funding from that government source. And they've got big lobby groups that make sure they keep their rural health designation, even if the community is not rural anymore. It's
Yeah.
amazing how that works out.
So the going forward, what is I see happening is that the frontline healthcare workers are going to be used as political tools for more government spending, more bailouts of the big hospital systems. Just like, the education establishment and higher education are constantly talking about, teachers. They use teachers as that, we need to give teachers more pay and to raise your taxes in your local state, which then most of that money ends up going to the administrators of the education system. I see the political system, the politicians on both sides, possibly really using nurses and doctors, saying that look at all these nurses and doctors that have been furloughed during this. We need to have more bailouts. And is that going to help the doctors and the nurses? Probably not as much as it's going to help the CEOs and the administrators of those big hospital systems.
Absolutely, and you see it a lot. I talked to a handful of doctors and a handful of nurses and other healthcare professionals that, they don't believe what their big clinic is doing in the lockdown, or what the hospital is doing, but they have to play along because they work there. And it's really sad that doctors, go to medical school for a long time, pay a lot of money to get educated, and they go to work for a system, and they literally become slaves. They're servants. They can't individually decide a lot of times, even how the care of the patient. They get in trouble for the care of the patient, and of course, if they speak out politically, then they're in big trouble. And it's really, really sad to see it. I hope what this pandemic has done is it liberates a lot of physicians to say, I'm done with this. I'm going to do
Yeah.
something myself. And direct primary care, even if it's not primary care, there's a lot of specialists too, like you say, with surgery centers and endocrinologists and many different specialists that are going on their own now because there's a market for it, because patients are tired of it too. Patients are not getting the care they deserve when they go to a big hospital system or a big clinic system where they have to wait for appointments and multiple specialists every time they go in the office for something that's simple and can be treated by a primary care provider.
Yeah. I guess I would also add maybe some optimism. I'm not in favor of using the government to bully people or to force anyone to do anything, even the big hospitals. We have always advocated for for the free market to drive transparency more than having a top-down edict from the government to demand transparency. I think the patients in the marketplace would normally demand transparency if the structure is not already so regulated. But as we saw the executive order from Donald Trump last year on price transparency, he got massive pushback from the hospital suing over that, saying, well, there's no way we can do that. What we're seeing now, and I think Trump talked about this just a day or two ago, saying that now, we need to have more. He mentioned this price transparency again. I think what he's going to do is he's going to use this as leverage for him to push for more price transparency. And maybe that's a good thing. As much as, I don't like necessarily the method, the result might be could be a great thing, to say that the next round of these COVID-19 bailouts, there will be some sort of requirement that you have more transparency, and maybe that is the impetus to drive things more toward a free market. I'm just trying to have some optimism here.
Yeah, no, I'm with you. I'm not optimistic in government, and I definitely don't like government mandating anything.
Mm-hmm.
But and that's one of the reasons that we have you on, is because I think the biggest thing that we can do, one of the goals of this radio show, and the reason I wrote a book, is because I want to educate and empower consumers that they control their own healthcare. And if we start educating people, and the Free Market Medical Association and all their healthcare providers that are members are part of it, we start educating people and those providers that healthcare is shoppable. It is a commodity like anything else. And I get it. I get it. I mean, there's people out there that are going to say, Shawn, it is not a commodity like anything else. People die without healthcare. I get that. But people die without food too. And we let people choose what food they get to buy, at least for now. Now, there's some scares in there when we talk about the food processing and how when we realize how much control the government has over our food supply, that eventually we might not be able to decide what kind of food we can eat. And that's really scary. So we get to decide what kind of car we buy, what color it is. Healthcare should be no different. What kind of price we get to pay. Healthcare should be no different. And when a hospital or a clinic tells you that, oh, we don't know what the price is going to be, it's too complicated. Well, a new car is a pretty complicated piece of machinery, but they know exactly what it's going to cost when you go in there to buy it. Yeah. And if you want XYZ option, they know exactly how much more it's going to be. So don't tell me that healthcare is any different. And a perfect example is go to the Surgery Center of Oklahoma site. It's amazing the different surgeries that are listed on there, and there's just a price. It's incredible. You just don't see that anywhere else. Well, you do now, because Dr. Smith has been so out front and in the forefront of that a lot of clinics are following. But it is possible to know how much it's going to be for total knee surgery. It is possible. And that's all inclusive. No secret bills afterwards, no surprises, no add-ons later. It's $6,375, period.
Well, it is complicated, but it's only complicated because they've made it complicated. Right. I mean, if every person going into the grocery store paid a different price for a gallon of milk, the cashier would probably say it's pretty complicated, because I'm not, you're trying to get through the line as quickly as possible. Right. And they don't have time to figure out, what little special deal or contract you belong to charge you. So that would be the case in anything if everybody paid something different. So the problem is there's no equality in prices. Everyone pays a different price, and they made the system, the hospitals and the insurance carriers and there are a lot of middlemen in the process that make a lot of money on on that complexity. It doesn't have to be that complex, but going back to what we're talking about, healthcare workers being furloughed and things. There is some truth to the idea that there needs to be a complete restructuring of the healthcare system, and those jobs need to be, those physicians, nurses, administrators need to be reallocated in a free market way. The biggest problem with government control is that resources are misallocated in the wrong direction. So a lot of those administrators might be unnecessary. They need to be doing something else. They need to be working for a free market entrepreneurial hospital or facility, and there would be jobs available in healthcare for those people that might not necessarily be in that big hospital where they were working. So I think the other thing we need to push is for more deregulation on the state level. All these things that were suspended because of the emergency, like certificate of need laws. We've talked about that quite a bit, but those need to be permanently removed so the market can respond. And as these, if we allow hospitals to fail, I think hospitals should be able to fail the same as a airline should be able to fail and be restructured. It's not that service is going to go away. It just means that we need an opportunity for more effective entrepreneurs to step in and manage those facilities and start new ones to respond to it.
Right. I mean, they could have been just running inefficiently, and that might have been why they failed. So, I mean, they could definitely restructure, not necessarily go out of business, but just restructure their whole business plan. So,
yeah.
So, do you have anything else to add about the free market? Any closing words, James?
Well, it's going to be interesting to see what happens over the next few months and years, but I haven't seen anyone recently calling for more Medicare for all type things. I feel like there's a growing distrust of the establishment in a lot of different areas right now. So maybe we can, extend that to help people realize that you would not want Medicare for all or more government intervention and more government control of healthcare than we already have right now. I mean, if anything, the regulations that were already in place from the CDC and the FDA slowed down the free market in getting testing done, in being able to trust that the tests were accurate, the protective equipment that a lot of my healthcare friends, people that were working on the front lines, were saying they didn't necessarily have access to. They didn't have access to it primarily because of government regulation and misallocation of those resources, where, the places that needed those things the most didn't have it. Yeah, that's all I would say, is that I feel like there's a great opportunity right now to keep educating people on how the free market can work better in all areas of life, especially healthcare.
Yeah, no, I'm totally with you. So well, thank you for being on our podcast today, James, and stay tuned for Monday's edition. We're going to have Michelle Murphy. She's a functional medicine clinician, and she's going to be talking about cardiovascular deaths in America and how a lot of them are preventable. She is a super great resource, and I'm excited to have her on. We'll be streaming live at AM 1470 KBSN in Moses Lake 1 to 2 p.m. as we do every Monday. And next Thursday, our Thursday edition of this podcast at 8 a.m. we will be talking about, is cholesterol bad? So do you take a cholesterol medication? you want to tune in because you might learn some things. So we appreciate you being on today, James. And that concludes our episode today. And we thank you all for listening.